Today we're talking to two gynecologists about myths about going to the gynecologist. We're going to touch on some hot topics like, can you tell if I've had sex right before my appointment? Or, do you care or notice that I've shaved my legs before I've come in? And we're going to touch on a hot topic about pineapple juice and what it does to your nether regions. I'm Sarah King, and I have a lot of questions. What exactly happens when you orgasm physically? Will popping a knuckle or a joint give us arthritis? What can we learn from our poop? If I have sex the night before my pap smear, can it mess up my results? In this show, I get to ask all these questions to WakeMed doctors who happen to know everything about everything. Sarah Has Questions is a production of Capital Broadcasting Company and Mix 101.5. It's presented by WakeMed. Welcome to Sarah Has Questions. Today we are talking to two gynecologists with WakeMed, Dr. Darlene Esper, welcome.
Thank you so much.
And Dr. Angela Gant.
Hi.
Hi, how are you?
Great.
I hear you two are work besties.
That is true. We are.
All right, well, I'm excited to go through these myths that we have for OBGYN and gyno visits. So let's just jump right in. Yearly gynecologist visits, yes or no?
Yes, but it doesn't have to be with a gynecologist. I think if you feel like you have a primary care doctor who feels comfortable answering your gynecologic questions, doing a pelvic examination, making sure you get a yearly breast examination, it doesn't have to come from a gynecologist.
Okay, so it can be your primary care provider. Dr. Esper, when should people start annual appointments?
That's a great question. I think it depends in a sense. We do, for most, they think it's 21 is probably the age that most people think about because...
Really? Because I would imagine, I'm sorry to interrupt you, but I would imagine that I know I did. I went to the gynecologist when I was like 12 because I started my period.
Right.
And so that's what I always assumed is when you start going to the gynecologist. But could it be earlier?
It could be earlier. We see young girls as early as the age of 9 or 10 if they're having menstrual issues. So oftentimes, especially if we get consultations in the emergency room, they might have a pediatrician who they routinely see. Uh-huh. And then if a young girl is having menstrual issues at that time, I explain to the parents, if you have a good relationship with your pediatrician who is well attuned to this, which most pediatricians are, then you can follow up with them. But we're also happy to see you at that point, whatever your comfort level is. And oftentimes we end up seeing those young girls because we have to start some type of treatment for menstrual suppression, potentially, or discussing other issues. It can vary, essentially. And now that when the pap smear guidelines were so different years ago, so we saw girls at a younger age oftentimes. And since those have changed, it can vary. So I would say, perhaps if by 18, most people are out of the pediatric window, then they can start seeing a gynecologist as well.
And so it's not all about when your period starts. It's just at just the age you want to go, basically. I mean, could you just decide to go?
Sure. Yeah, absolutely.
Yeah.
Absolutely.
But again, your pediatricians are actually well versed in this for the most part.
Okay.
So I'm going to treat them like a primary care doctor.
Okay.
And if they feel comfortable talking about sort of that initiation of menstruation and the expectations for some irregularity in the first year, and when it's problematic for the person, then you don't need to see a gynecologist.
Okay.
With that said, if there's any questions or concerns that the patient or the patient's parents don't feel as though their pediatrician is able to answer, there's a low threshold called a gynecologist.
Well, so now you're like in midlife, you're in your 30s, you're going to the gynecologist yearly. When do you stop these yearly visits? Do you have to stop them when menopause happens?
Your primary care doctor, again, you should see someone every year. So you should have an interaction with the medical community every year. And if your primary care doctor is comfortable and you are comfortable having a discussion with them about your perimenopausal symptoms and your menopausal symptoms, then you absolutely don't need to see a gynecologist.
Okay.
Again, though, you still need to have someone who is going to be comfortable performing a pelvic examination every year and doing that breast examination, as well as ordering the appropriate tests based on your age.
Okay.
So a lot of primary care doctors are comfortable doing it. The access potentially to gynecologists may be more limited. And so if that's an availability to you and you have a comfort level, then that's perfectly fine.
Is the same true for these annual exams if you've had a hysterectomy?
Well, we define hysterectomy differently.
Can we also get rid of that name, the name hysterectomy? Because I know it's got to do with hysterica.
I don't think so. Yeah, not yet.
That's a whole nother ballgame, but it's always bothered me because of the origins. Anyway, go ahead.
Interesting. I never really thought about it like that, but makes total sense.
Yeah, right? We can rename.
We'll try to figure out how to rename it. Mm-hmm.
That's homework.
Yeah,
Homework.
So hysterectomy, it depends. But the main thing that women need if they're not getting pap smears would be a breast exam and still a pelvic exam. So as Dr. Gant had mentioned, it depends what you define. There's with hysterectomy. If the ovaries are still in situ, which very much so that's the case right now, we're not taking out ovaries for every patient that has a hysterectomy. And so a pelvic exam is warranted to see if there's a pelvic mass. There's not really good screening tests for ovarian cancer. And so that's why you would need to see either your gynecologist or, again, a primary care physician, because it can vary from different towns. Sometimes a small town, the primary care physician is the person that cares for everyone in that town and is very well versed in gynecologic care because they have a niche for it. And others, perhaps in urban cities, are more likely to refer potentially. So it just depends. But the breast exam and the pelvic exam will need to be done yearly.
Until the day you die, basically.
Well, here's what's important. Yeah. What are we looking for? Right. So it's not just the examination, but what are you concerned about with someone who has gone through menopause? Is ovarian cancer breast cancer? And so those are the things that need to be evaluated on a yearly basis.
That makes sense. We're going to get into the nitty gritty now. I know I have done this. Should you cancel your appointment if you're on your period? Dr. Gant, why don't you field this one?
So I like to say that it's an occupational hazard for gynecologists. We're very comfortable taking care of patients who are actively on their menstrual cycle.
Okay.
So really it's the comfort level of the patient.
Yeah.
The gynecologist is very comfortable managing that area. Would you agree with that?
Yes,
Dr.
I would say no, do not cancel. That's an
really
old
even
myth.
if you're really heavy.
No, well, it's an old myth, and that is because the way we used to do pap smears, blood would interfere with that result, and the new technology, it doesn't interfere with it. So that's where that comes from. Essentially, is patients years ago would call and we're like, well, we need to cancel your appointment. And that's not the case anymore. So I would just keep your appointment. It's hard to get an appointment as it is these days.
That's true.
So keep your appointment unless, you're not feeling well otherwise.
Right.
So, yeah.
I just do it because it just kind of, it's just the last thing I want to do when I'm on a heavy day of my period is
that's understandable.
That's totally fair.
So that's
totally fair. If you're not comfortable doing it, then
make a new appointment.
But we don't think that we have an issue with it.
Okay, perfect. What exactly is a pap smear for? What are you testing for with a pap smear? Either one of you can take it. Dr. Esper.
We are testing for abnormal cells on your cervix, so it's a screening test for cervical cancer.
I see. People come in thinking pap smears are for STIs. Is that correct?
Sometimes they do think that it screens for STIs, and I will say when we obtain a pap smear, we can add a gonorrhea and chlamydia test only when we're doing the pap smear, but it doesn't test for any of the other sexually transmitted diseases such as HIV or syphilis or herpes. So you would need serum blood tests for that.
Okay. And you said people call often. This is you guys behind the curtain. You two sent in some myths that you encounter as gynecologists. Mm-hmm. One of them says, and I have to ask you, it says it's probably a yeast infection. One of you elaborate on that. How about Dr. Gant? Can you elaborate on what it means when someone, why you guys wrote in? It's probably just a yeast infection.
So I think patients will send us these comments where they'll reporting they have vaginal discharge, and so they believe it's yeast infection because it's kind of the common thing that someone will believe that there are.
Well, we don't really know much else that's going on down there.
Exactly. But there are a multitude of bacteria, including and viruses and fungi that actually can live in our vagina, and they're quite protective, actually.
Okay.
And you can have a physiologic discharge that's also quite normal. So the concept is if you have some kind of vaginal discharge, you believe it's a yeast infection.
Even if you don't have the itching, there's no itching associated, people will still call you with this?
They might believe that they do.
Wow.
Just because they're learning more awareness of their body, and so somehow they pay attention or they notice that for a day or two and they become concerned.
Okay. All right. And are IUDs dangerous? We're just jumping all over the place. IUDs, first of all, explain what that is. And Are they dangerous?
So it's a type of contraception we place in the office. If you talk to most OBGYNs, they love that type of contraceptive method. I'm a huge, believer in that method because of its convenience, the fact that you don't have to take a pill every day.
Which is nice.
And that now often some of the IUDs are able to be in the uterus for 8 to 10 years.
Oh, wow.
And they work really well. Now, sometimes they do fail. They're not 100%, and you can achieve a pregnancy from that. But it really is not dangerous unless, and I think where that myth comes from is back in the 70s when they first came around, there were some infections that were reported and some safety issues with a certain type of IUD. That IUD has been off of the market for many, many, many years, and there have been subsequent multiple studies. The IUD is the most common contraception that's used worldwide.
Is that right?
Yeah. So most of us try to, obviously we offer other options for contraception, but it has a lot of benefits. And it's also very popular to use for women who need really good menstrual control for heavy bleeding, even if they don't need contraception. So it has a lot of benefits.
So is there medicine in an IUD?
There is progesterone in the IUD. So you get a slow release of progesterone.
Like an 8 to 10 year release?
Mm-hmm.
Oh my God.
Yeah, so it's usually 8 years. The 10-year IUD is a copper IUD. So the copper is toxic to the sperm, essentially.
So there's no medicine in that.
Got it.
It's the metal
the copper
itself that is causing.
So when I was one of those 1970s babies, late 1970s. I'm just kidding. I don't really care how old I am. I made it this far. I should celebrate it.
That's okay.
It's better than the alternative.
Yeah. Exactly.
I think we're with you.
But the fear was that it was going to be born in me. Like it was at the time, like my mom was afraid it was going to be in my shoulder or something because it was, apparently I held it in my hand as I came out and was like, you dropped something.
So that's a really good question.
Yeah.
When the intrauterine device fails, meaning that a pregnancy occurs, then we will sometimes have a discussion with patients about what to do because they're early in their pregnancy in terms of removing the IUD versus continuing to leave the IUD until the end of pregnancy.
Right.
The literature is actually really confusing about which way to go in terms of removal versus leaving it in situ. There's really no adverse events in terms of how the pregnancy progresses, i.e. we see you.
Yeah. Well, you don't know me very well. I'm just
and maybe
kidding.
that's fair. And maybe a few but small complications for removing it earlier.
I see. Okay.
So that's really a discussion you got to have directly with your OBGYN.
Yeah. All right, well, let's move on to pregnancy. Let's say the IUD failed. We're going to talk about a myth about exercising, that exercising during pregnancy is harmful. Is this true?
No.
Absolutely not.
All right.
Get out there and walk, ladies.
All right.
For sure.
So what kind of exercise is recommended, Dr. Esper?
Oh, you can do any type of exercise. Really, the only, anything that you're comfortable with. Obviously, if you haven't exercised in your life. Now, pregnancy isn't the time to start your fitness journey, although I would encourage all women to do, some type of cardiovascular exercise. Strength training is safe to do. The only exercises that we place caution on is maybe like skiing.
Where you can have like a massive
fall
injury
or something like that. And certainly once you get into the third trimester, 34, 35 weeks around that time, just because of the way our body changes and how we're shifting, we can have some gait abnormalities. So sometimes women can be more prone to falling. So just, being cautious with that. But we certainly have patients that are swimming every day. We have patients that are marathon runners and continue to run every day.
I can't imagine.
And they're just, so any of those things are great to do. And we would encourage it because there's huge benefits for the pregnancy and for the patient.
Well, and also labor is like one of the most physical things you'll ever do in your life, so you don't want to be in your weakest state, although it does happen.
I mean, there's pretty good data even that the labor experience is better for patients who've exercised up to the very end.
I would believe that.
I generally will tell patients if they're lifting weights, probably about 60 to 70% of what they would normally do.
Okay.
But women are smart, and so they kind of know as they progress in their pregnancy, it's harder to do certain things, and so they will normally modify.
Yeah.
To what their comfort level is. And so there's very little guidance that you need to give. But when someone asks me, I'm sort of like, if you were lifting 100 pounds, I'm just going to say that you may reduce that to 60 or 70.
I was actually
getting ready. That.
I was going to get ready to ask you about that because you see these, on social, these people like lifting really heavy weights, and I don't know, it just seems counterintuitive, but you're saying it isn't, so I love it.
Right.
All right, Dr. Gant. High-risk pregnancies. There's a myth that you have to be on bed rest for it the entire time. Is that true?
So the term high-risk pregnancy is so broad that it can include about 100 different things, and that's probably not enough of a number. There's very little data that says that strict bed rest of any sort is of benefit and actually can be cause more complications later down the road.
Oh, yeah?
Because you're not active.
Yeah.
We just finished talking about activity and the benefits of said. So in general, the idea of bed rest has very limited benefits. If you are talking to someone about bed rest or at least a modified kind of bed rest, then you really should also be considering hospitalization for someone.
Oh, okay. I think it would help also with recovery, exercising while
100%.
you're... Because you're doing the hardest thing you've ever did in your life, which is labor, and then they hand you a baby. You don't get to sleep. Like if you're out of shape. Ugh.
Not only that car seat. That car seat can be brutal with
my
a 10-pound baby.
Yes.
Very much so.
I had a 9-pounder when he was born. My arm was sore. Okay, so Dr. Esper, I actually heard this while I was pregnant, that you should only sleep on your left side. Is there any credence to this?
So I will tell you where that comes from. So is the fact that we know in the hospital setting, we know that when we have a baby that maybe looks like it's having some heart rate abnormalities, we tend to turn that patient to the left side in order to optimize venous return, which is like the blood flow through your body. Because with a uterus that's gravid or enlarged, it can compress some of those vessels in your body, right? And so that information was extrapolated to, hey, you should probably sleep on your left side. But that's where that comes from. I would say, for most patients, like sleep where you're comfortable so that you get really good sleep, essentially. It tends to be, most people can't sleep on their stomach when they're pregnant anyway. But really, there's not good literature. They have not done studies on pregnant women taking women who've slept on their left side versus their right or on their back. But that's where that comes from. So if you can get comfortable on a side and you got to pick one, you could try the right, but there's not going to be poor outcomes with your pregnancy.
The other thing is that you can't really control when you're sleeping how you turn, right?
Yeah.
So if you notice that you're on your left side when you wake up in the middle of the night to go to the bathroom or anything else, then you can just rotate.
Yeah. Okay. All right. Now, there's a lot of rules put on pregnant women for eating and drinking. And a myth is that you are not allowed to have coffee or caffeine while you're pregnant. Let's discuss this. Dr. Gant, what do you think about coffee and caffeine?
So we discussed this morning because I just learned that the coffee that I drink probably has more caffeine in it than I thought.
Congratulations.
Because in my mind, I was like... 1 cup may be equal to 24 ounces, but that's not actually the case.
What kind of coffee are you drinking?
I mean, that's just what my mug fills up to.
Oh, I see. I thought you had like nitro burst or something.
No nitro burst. So we thought it was important to put a number on it, and really is 200 milligrams, because if you go to Starbucks, what she gets and what I get might be very different.
That's a good point, yeah.
And so what you want to know is what the milligram version is. So averaging about 200 milligrams per day is probably safe.
Probably safe, but we don't so what can go wrong?
I don't think there's any literature that says it's not safe.
Gotcha. Okay.
And I don't even think that I think that is no different than what the recommendations would be for a non-pregnant person, honestly.
Interesting. So it in my mind, when I was told to maybe drink decaf when I was pregnant, this was like 9 years ago, I always imagined it had something to do with their heart or something. It would make their heart, I don't know, like this is the stuff you think about when you're pregnant, No,
that's a good point, Sarah. Definitely pregnant women sometimes can have where they feel fluttering in their heart or what's called an arrhythmia.
Yes.
So sometimes you can just develop that in pregnancy. If we have a patient that develops that sort of thing and notices that their heart rate's a little bit faster, we do tell them to decrease their caffeine consumption if they're drinking that and make sure that they're hydrated.
Okay.
But we don't place a limit on no caffeine versus not unless there is some type of, if there's a cardiac thing, usually your cardiologist has mentioned that as well.
Okay.
I think, like Dr. Gant mentioned, knowing your milligrams, because for me, I'm a coffee addict.
Who isn't these days?
But
it's exhausting
I
being
drink
an adult.
mostly espressos, and most people think espresso has the highest, amount of caffeine, and that's actually not true. So it kind of depends on your bean. It depends where you're getting your coffee from. And most places, like if, Starbucks is an example of a popular place, they will show you in their nutritional information how many milligrams of caffeine
That's useful.
are in your coffee. So typically, sometimes drip actually has more than an espresso drink.
Okay.
So.
When I was pregnant, I craved a ham sandwich more than anything in the world. And I was so terrified because one day I went into my craving, and I will never forget it. I sat in Fred Fletcher Park and I ate that sandwich with the most relish. Anyone could, not actual relish, like enjoying it. There are certain things like soft cheese, deli meat, sushi. These are all things we're not supposed to eat, Dr. Gant. Is there any credence to this, or is this all a myth? Like, why would you not be able to eat a ham sandwich? Why would you not be able to eat sushi? Because these are all things your doctors tell you.
It's not that you can't eat any of them.
Okay.
But there is this concern about meat or soft cheese products that sort of live at a certain temperature that's ideal for consumption for the human, that may expose you to certain viruses that may live in that space, Listeria being the most common one.
Is that what causes food poisoning?
Well, lots of different bacteria can cause
Okay.
food poisoning, but Listeria in particular is concerning for pregnant women.
I see. Okay.
And so that's why we usually say to avoid it or cook the meat beyond what would be normal in the deli scenario.
Okay.
In regards to sushi, I mean, I think if you look at Asian countries, they're eating sushi all the time.
Right.
And so it's really about volume and sort of like what kind of sushi you're eating and then how much you're eating in a week's period of time.
Right. Okay.
Based on sort of the minerals that exist within seafood.
Oh, that makes sense. Yeah. I remember when I went to my doctor, I was like, I had a ham sandwich. I'm really sorry. He's like, just don't eat it every day. That was his answer. Just, you can have one, but at the end of the day, you're just trying to keep Listeria and those types of things out. So it is.
Everyone obsesses about sushi and deli meat and soft cheese, like unpasteurized cheeses. But sometimes where contamination, we're seeing it in our foods now, is just not washing your fruits and vegetables appropriately. Yeah. So you can get Listeria just from lettuce. And so it essentially, which is not common, but food is getting contaminated that way. So I think also a really good measure is to make sure you're washing your produce really, really well, because we're seeing a lot of recall and that sort of thing. But just as she said, I think really for me, food choices are in moderation. As long as you're not eating that deli sandwich, I craved a lot of salty meats when I was pregnant.
Did you eat them?
Yes.
Good.
And I also ate sushi.
Did you?
So, yes,
I did
because
not.
It has to do with contamination. So make sure you're not eating,
drugstore
3-day-old fish. But also you have to be careful if you're someone who consumes a lot of fish, which she was talking about minerals, is like how high the mercury content is in certain fish if you're someone who's a fish lover. So typically there are benefits to eating, seafood in general. So salmon, for instance, is a great fish to eat for the omegas. And so most of the time, if you can get 2 servings of that a week, it's great. So just being cautious with your food and knowing where you're getting it from.
That's
sort
fair.
Of thing.
That's fair. All right, now we've come to what you don't know, because these are questions you did not send in. These are our listener questions. I wish I had a sound effect.
We'll make one for you.
I love it. Okay. First question. If I have sex the night before my pap smear, can it mess up my results? Wow, you guys are really thinking about it.
Overall, I'm going to answer no.
Okay.
That it should not mess up your results. There can be trauma or irritation from intercourse and the mechanical activity of that.
Okay.
And sometimes the cells, in terms of like what they're looking for on the pap smear, may show some conflict. But in general, no.
That is, I've never heard sex described as mechanical.
I mean, I think we can all visualize that.
No, I know the motion to which you are referring. So then that kind of answers this next question, which is, can you tell if I have had sex recently in a PEP, if I'd had the night before and I go in for a PEP? Are you able to tell that, they'd gotten busy very shortly before then?
No, not really. I mean, if we are doing the PAP and someone's also complaining of discharge, we oftentimes will do tests under microscopy, and we can see sperm if it's been recent, but it shouldn't interfere with your pap smear result because that's, fixed in a solution and sent to a pathologist after that. So those other cells are dead by then.
Okay. Now this one, I've felt this. I don't know. I mean, I know you guys get paps. Maybe you've felt this. Do you notice if I've shaved my legs before I come into a pap smear? Do you notice this? Because I always make sure to do it. And this is not my question, but I feel it.
It's such a good question.
Punt that to me.
No, I'm not going to punt that to you because I as a patient, I've sometimes felt like, oh my God, am I ready to go to the doctors?
Like
right?
take a shower, shave in all the places.
And invariably, I have a patient. I know you have patients that will be like, oh, don't notice this about me before you start. I don't pay attention to it until the patient notices. Highlights it.
Okay.
At which point I still don't care.
Okay.
But I do notice that they highlight it.
I will say that they all know this. I'm obsessed with skin things, so I notice everything. But my patients will say, "Oh, I didn't shave my legs," and I tell them, "I didn't shave my legs for you either." And that usually
that's
breaks
hilarious.
the ice.
That's hilarious.
But yeah, I typically notice. I notice everything about people's skin. I'm like, "Dude, what is going on over here? Can we talk about it?" So they know that of me, but you don't have to worry about shaving your legs because we're not doing it for you. I promise.
Okay. Perfect. All right, next question is, does anything gross you out? Are you desensitized to anything? And I do have a personal story with this one. I did read these before. And I can't believe my colleagues are sitting in the room recording this, and I'm going to tell you anyway. So I went in for a PAP, and I had a yeast infection, right? But the gynecologist recoiled and said, "Ooh, you got a nasty yeast infection." I was like, yikes. First of all, who says that to somebody? But she was clearly grossed out by it. So do you guys get grossed out by stuff?
I get grossed out by throw up.
Okay, good to know.
But I might say to a patient, you have a nasty yeast infection, not because it's grossing me out, but because it's very obvious. I don't need to do a test for it. But I think you're teaching me that I should probably be
nasty's not a word that you should
use. Wording
yes.
that I may use of my patients. So I don't really get grossed out about anything that I am responsible for.
Okay, that's fair. How about you, Dr. Esper?
I think we get desensitized over time. For me, the only thing that really grosses me out is when I'm in the operating room and they're suctioning a patient who is, vomiting or
vomit.
Yeah, vomit.
Vomit.
Look at you. You guys are work besties and you're the same.
I don't like the vomit.
It's gross.
Yeah.
Okay.
That's it.
All right. And this is the last question.
Okay.
It involves pineapple juice. Do you know where I'm going with this?
No.
Really? This is a well-known thing that I heard in college, and when I saw the question, I was like, good question. So the myth is that if you drink pineapple juice, your lady bits will taste and smell better. Same for men. That's what I've heard. Any thoughts? I wish that everyone.
What college did you go to? Because I didn't.
NC State.
But I think
that's why, because I'm a Carolina.
I wasn't told by a professor, by the way. This was just word in the dorm.
I don't think there's any data to that, but I will say that certain foods that have really pungent smells, like garlic, onion, that sort of thing, they will come out of your skin. So, so you can, when you're sweating, you'll smell them.
Right.
And I think if you're very dehydrated, it'll be concentrated. And so that's why sometimes patients will notice that their body odor is a little bit stronger, that sort of thing. In addition, I think there is, as far as like skin cells, like when you're not exfoliating tissue, that buildup can create a little bit stronger body odor. But I'm not aware of any data that says drink pineapple juice to make things smell better.
Okay.
Yeah.
Well,
but I don't think it's harmful.
Yeah. I mean, it's pineapple juice. Yeah. All right. Do
do you have anything about pineapple juice?
I got nothing.
Supposed to be good for your skin,
I haven't
ladies.
had it in
Oh,
a
is
while. I
it?
think I'm going to.
I can talk all day about cocktails, morning cocktails, and juices. Because she knows.
I'm going to go get some pineapple juice. I don't know.
Pineapple juice, ginger, cucumber, and celery in the morning is great for your skin.
Oh, good to know.
Really?
Yeah, that's like my new, morning thing. Okay. Anyway,
Wow, bonus.
but there
If you
go.
got to the end
Yeah,
of the
there you go.
podcast, that's your bonus.
Good to know. That's
Well,
what they
thank
say.
you so much for coming in today. This has been fun, and I really kind of wish I worked with you too, because you're really fun together.
Well, we'll come back. We'll come back.
Okay, cool. My guests today were Dr. Angela Gant and Dr. Darlene Esper. You can find them both at WakeMed.org. If you have a question you'd like me to ask or an idea for a future episode, don't be scared. Get in touch. Go to WRALFM.com/Sarah Has Questions. We would love to hear from you. Links to WakeMed and our podcasts are both in the show notes. All right, ladies, go schedule those annual exams, and we'll see you next time.